Let me start recording. Okay, we were doing the chemotherapy, chemotherapy of cancer. We have done a few classes on chemotherapy of cancer, and then we have done all this. We have explained you various classes of the chemotherapeutic agents, alkaloidic agents. I think we have completed alkaloidic agents, antimetabolites. We have completed antimetabolites, and then we were in natural alkaloids. Okay, so today I am scheduled to do with you natural alkaloids and antibiotics. This whole section I'm supposed to briefly take you through. Okay, so with this, let me now jump down to Vinca alkaloids. Do you know what is Vinca alkaloids? Have you seen the plant that produces Vinca alkaloids?
Vinca rosea.
Have you seen the plant? Have you
Yes, sir.
seen the plant?
Yes, sir.
There, yeah, it's all around here. No, that beautiful small white and blue, the flowering plant. Okay, Vinca alkaloids. See, one thing you need to know as M Pharm students, the natural compounds, especially we study in so many natural compounds. Especially you do your second M Pharm projects on many natural compounds. We've been working on that. We do the extraction and then they study this activity, that activity, and all those kind of stuff. And so these natural compounds, I used to wonder so much we're doing on this natural compound. Are they useful anywhere in the world? Okay, there are many drugs are there. All those atropine and all those things are from natural only. You are what is that? The mm, so many drugs are there. Okay, so many drugs are there. Here Vinca alkaloids in the anti-cancer. There are so many agents which have been very well established to be anti-cancer molecules. So we also do so many anti-cancer screening. We have worked on some anti-cancer molecules. In fact, in our lab, we have done some screening of anti-cancer molecules. We have gone into many other mechanisms, deeper mechanisms of action. We have tried to investigate, and it has been very exciting working on anti-cancer. Any of you have do anti-cancer projects? None of you have planned any projects so far, is it? Hello?
So we planned, but not anti-cancer. Maybe. I don't know about others.
Okay. Anti-cancer is a good area to work on that, okay? So think about an anti-cancer compounds and if you can work on that. Now, Vinca alkaloid, natural compounds, Vinca alkaloids, vinblastine and vincristin are the purified alkaloids from this periwinkle plant, that is Vinca rosea. They're used for the treatment of leukemia, lymphomas, and testicular cancer. Okay, so vincristin is a standard component of regimes for treating pediatric leukemias, lymphomas, and solid tumor. Very interesting compound. But whereas, say similarly, vincristin is more useful for remission induction in lymphocytic leukemia. So vincristin also is a standard component of the regimes used in the treatment of pediatric solid tumor such as Wilms tumors, neuroblastomas, and rhabdosarcomas. Okay, so these are very interesting compounds. And vinblastine, vinblastine, and vinorabin. Okay, so vinblastine is employed for bladder cancers, testicular carcinoma, and Hodgkin's disease. Very interesting molecules. Whereas vinorabin is actually used against non-small cell lung cancer and breast cancer. Okay, so many times we look at these plants and say, "Array, they are only for beauty. They are not just for beauty, but they are for curative purposes." Okay, they are amazing curative molecules. The mechanism of Vinca alkaloids is cytotoxicity due to their interaction with tubulin and disruption of microtubule functions, particularly of microtubules comprising the mitotic spindle apparatus. You know what is mitotic spindle? So it is acts specifically on the microtubules and the mitotic spindle apparatus, directly causing metaphase arrest. Okay, so Vinca alkaloids connect to binding sites on the tubulins. So binding of the Vinca alkaloids to these sites interrupt the microtubule congregation, that means aggregation, and they have a power to inhibit malignant angiogenesis. Okay, so Vinca alkaloids inhibit cell proliferations by binding to microtubules, which can cause a mitotic block and apoptosis. Okay, apoptosis is a very important process. So whereas vinblastine, it causes all this anti-cancer, as I've been saying you earlier, have significant the side effects. So vinblastine, GI disturbances, including nausea, vomiting, anorexia, diarrhea. These are then primary toxicity is the granular cytopenia. The syndrome of inappropriate secretion of antidiuretic hormone is also being seen. Loss of hair. So invariably, all these chemotherapeutic agents will show alopecia, that is loss of hair. Stomatitis and dermatitis occur infrequently. See, extravasation during the injection may lead to cellulitis and phlebitis. So you have to be very careful when you do an injection of these particular things. So it may cause cellulitis or infection at the site of injection, and phlebitis. That means there will be growth happening over there, or the swelling may happen. So clinical toxicity of vincristine is mostly neurological. Several severe constipation, thrombocytopenia, anemia, polyuria, dysuria, fever, these are also frequently seen. Okay, I'm not going into more details, and we'll just touch base upon these things. You can study more because your syllabus does not really encourage us to go more deeper into these things. Okay, so you can go study little more on those things. Very interesting compounds. Taxanes, paclitaxel. Taxanes are also, they are isolated from bark of western yew tree, and its semisynthetic congener docetaxel exhibits unique pharmacological action. So you need paclitaxel and docetaxel. They are very good anti-cancer molecules. They differ from Vinca alkaloids and colchicine derivatives in that they bind to a different site of b-tubulin and promote rather than inhibit the microtubule formation. The mechanism is slightly different. So these have been very well used for the therapy of ovarian, breast, lung, esophageal, bladder, head and neck cancers, and their optimal dose schedule and use of drug combination is still being more studied. Okay, so paclitaxel binds specifically to b-tubulin and antagonizes the disassembly of the microtubules. So the bundles of the microtubules and aberrant structures derived from the microtubule appear in the M phase of the cell cycle, causing mitotic arrest. As I told you sometimes back, study of the cell cycle is very important. So when you are working on elucidating the mechanism, it's important to study the cell cycle. So cell killing is dependent on both drug concentration and the duration of the cell exposure. That means how long the cell is in contact with the drug. So drugs that block cell cycle progression prior to mitosis antagonize the toxic effect of taxanes. So resistance to taxane in some tumor cells is due to increased expression of the P glycoproteins. Then every drug, especially anti-cancer drug and antibiotics, have resistance. So we need to know the mechanisms of resistance. The other resistant cells have b-tubulin mutations and may display highlighted sensitivity to Vinca alkaloids. Okay, so then this is one more drug, what is called as camptothecin. Camptothecin is also this is isolated from tree Camphotheca acuminata. Okay, Camphotheca acuminata, and the lead compound is camptothecin. So camptothecin are potent cytotoxic anti-neoplastic agents that target nuclear enzymes topoimerase 1. Okay, so camptothecin analogs, there are two analogs are there, irinotecan and topotecan. Irinotecan and topotecan. These have activity in colorectal, ovarian, and small cell lung cancer. Okay, so it's very important. So these are also plant products, but such an amazing compounds are these. So DNA topomerases are nuclear enzymes that reduce torsional stress in supercoiled DNA, allowing selected regions of the DNA to become sufficiently untangled to permit replication, recombination, repair, and transcription. Okay, so there are two classes of topomerases. These topomerase 1 and topomerase 2, they mediate the DNA strand breakage and reseal. So both have become targets for cancer chemotherapy. Okay, so when you're doing the screening for cancer molecule, it is very important to dig deep and to see what is the mechanism action. So camptothecin analog inhibits the functions of topomerase 1, while a number of chemical entities, that is anthracyclines, epidophylotoxins, acridins, they inhibit the topomerase 2. So topomerase 1 binds covalently to double-stranded DNA through a reversible trans esterification reaction. Okay. Now, camptothecin binds to and stabilizes the normally transient DNA polymerase 1, and that is a cleavable complex. So although the initial cleavage action of topomerase 1 is not affected, but there is a realignment, the realignment is inhibited, that leads to accumulation of single-stranded DNA. Okay, so these lesions are not by themselves toxic to the cells, but the collision with the DNA replication fork with the cleaved strand of DNA causes irreversible double-stranded DNA break, and that leads to cell death. Okay, this is a very important mechanism action which you all should be aware about. So camptothecins are therefore S phase specific drug. S phase, what is S phase? That is, S phase is a phase in the cell cycle. That's why I told you earlier, we need to be aware of the various stages of the cell cycle and to see which phase of the cell cycle the drug attacks or attaches itself. So this is a very important clinical implication because S phase specific cytotoxic agents generally require prolonged exposure of tumor cells to drug concentration above a minimum threshold to optimize therapeutic efficacy. Okay, so decreased intracellular drug accumulation leads to resistance to camptothecin analogs, and that because the drug to be active, camptothecin analogs to be active, it needs to be in connection or contact with the drug with the pathological cells over a long period of time. Okay, now as I told you, every drug has resistance. Now, what is the mechanism of resistance in this case? So, the drug metabolism could have a role in resistance in irinotecan, but the liver and the red blood cells have sufficient carboxysterase activity to convert irinotecan to active SN38. So transient downregulation of topomerase 1 is seen after prolonged exposure to camphotericin. Okay, so also you see mutations. Most of the resistance is because of mutation. What do you see in mutation? Genetic transformation will happen. Genetic change will happen as a result of mutations. Mutations and post-transitional modifications lead to reduced topomerase 1 enzyme catalytic activity or DNA binding affinity are seen in case of camphotericin resistance. Okay. Now, this is one more drug, topotecan. Topotecan. Topotecan is generally used for ovarian or small cell lung cancer. This has a significant hematological toxicity, and generally it is used in with other anti-cancer drugs like cisplatin. So promising anti-tumor activity has also been observed in hematological malignancies and CML and myelodysplastic syndromes, etc. Now, toxicity for this is neutropenia with or without thrombocytopenia. Okay, tropotecan. Now, so I've just quickly took you through some of the natural antibiotics, natural anti-cancer molecules. Okay, I just try to tell you what is its action, what are its mechanism actions, what are its mechanism resistance. Okay, we didn't go more detail because doses and all those things. There's so much can be studied, but I think that is sufficient for you. You can go deeper into that. Okay. Now, let's one more class of drug as we saw earlier is antibiotics. These are specifically anti-cancer antibiotics. Okay. So, dactinomycin. Actinomycins has a beneficial, dactinomycin is also actinomycin, has a beneficial effect in the treatment of solid tumors in children and choriocarcinoma. So these actinomycins bind double-helical DNA, and binding of dactinomycin blocks the transcription of DNA by RNA polymerase. So this is the exact mechanism of action of dactinomycins. So the DNA-dependent RNA polymerases are much more sensitive to the effect of dactinomycin and then that are of DNA polymerase. So dactinomycin causes single-stranded break in DNA through free radical. See, most of these drugs, they cause free radicals. Free radicals, as you have studied, I think we have a chapter on free radical. They are the bullets, they are the scissors. They go and do the chopping. So free radicals, they cause the result, as a result of action of the topomerase 2. So this dactinomycin inhibits the rapidly proliferating cells of normal and neoplastic origin and is among the most potent anti-tumor agent that is known as on day. Okay. So the most common clinical use of dactinomycin is in the treatment of rhabidosarcoma, Wilms disease in children, anti-neoplastic activity in Edwing's tumor, Kaposi sarcoma, soft tissue sarcoma. So this dactinomycin is also used as immunosuppressant in renal transplants. Okay, so very important antibiotic. Now, the toxic manifestations of dactinomycin includes anorexia, nausea, vomiting, which are pretty common with most of the antibiotics, and hemopoietic suppression. That means the blood forming agent suppression happens with pancytopenia may occur initially, and also it will produce proctitis, diarrhea, glossitis. That means soft this tissue infection will happen, glossitis, especially in the mouth and all that. Then cheilitis and ulceration of the oral mucosa, then dermatological manifestations like alopecia with erythema, then disclamation, inflammation, pigmentation in the areas of previously they are exposed to X-ray radiation. So these are some of the toxic effects that we generally see. Okay, now let's go to some of the other antibiotics. This is one more class of antibiotics, commonly used antibiotics. These are daunorubicin, doxorubicin, epirubicin, then mito. Okay, epirubicin, then these doxorubicin and epirubicin have activity against human solid tumors. These compounds can intercalate with DNA, directly affecting the transcription and replication. Okay, so the formation of the tripatriate complex with anthracycline and with etoposide inhibit the realignation of the broken DNA strands. As a result, that broken DNA strand leads to apoptosis. As I told you sometimes back, they also generate the hydrogen peroxide and hydroxy peroxide free radical. These free radicals go as a knives. They attack the DNA, oxidize the DNA bases. So these drugs also show multiple drug resistance in tumor population exposed to anthracyclines. These are all what I told you earlier, were all anthracyclines. These anthracycline is a chemical class group name, no? As you all know that. Anthracyclines are exported the tumor cells by the cell membranes of the MRP transporter family and by the breast cancer resistant protein. That means they throw the drug from the cell. As a result, there will be resistance to this particular drug. Okay, so also there will be increased glutathione peroxidase activity, decreased activity or mutation of transferase 2, enhanced activity, ability to repair DNA strands. These are some of the biochemical changes that takes place in the resistance. Okay, these are the mechanisms of resistance. Okay, now let's quickly look at the doxorubicin. Doxorubicin. So this doxorubicin used in combination with cyclophosphamide. We have studied cyclophosphamide earlier. Cyclophosphamide, Vinca alkaloid, and other agents for metastatic carcinoma of the breast and small cell carcinoma of the lung, pediatric and adult sarcomas. Okay, including the osteogenic, Ewing's, and soft tissue sarcoma. One of the most common side effects of this is myelosuppression. Myelosuppression, leukemia, thrombocytopenia, anemia. These are the common side effects that we see with doxorubicin. Stomatitis, GI disturbances, alopecia are common, but generally these are reversible. Once the medication is stopped, then you see hair starts growing. Also, we will see facial flushing, conjunctivitis, lacrimation. That means the mouth salivation coming. And drug may produce several local toxicities in irradiated tissues. That means if it is exposed to X-ray, there will be this local toxicity may develop. Okay, the drug also produces cardiomyopathy. This is the most important long-term toxicity. Then this is another drug called as epipodophylotoxins. These are semi-synthetic herbal compounds. Semi-synthetic derivatives of podophylotoxins. Podophylotoxin are etoposide and teniposide show significant therapeutic activity in the several human neoplasms including pediatric leukemia, small cell carcinoma, testicular tumors, Hodgkin's disease, large cell lymphoma, etc. Okay, so these derivatives, that means etoposide and teniposide, form the tertiary complex with topomerases 2 and DNA, and prevent the resealing of the break that follows the topomerase binding to the DNA. As a result, it causes the cell death. So enzyme bound to the free end of the broken strand leads to accumulation of the DNA break and leads to the cell death. Okay. So then another antibiotics called as bleomycins. Bleomycins have significant anti-tumor activity against squamous carcinoma of the cervix and lymphomas and testicular tumors. So bleomycin's cytotoxic actions result from its ability to cause oxidative damage to the deoxyribose of thymidine and other nucleosides that leads to single and double-stranded break in the DNA. Bleomycin also causes accumulation of cells in the G2 phase of the cell cycle, and many of these cells display chromosomal aberrations, including chromatid breaks, gaps, fragments, as well as translocation. See, you have in your syllabus chromosomal aberration. You need to learn that. I think one or two of your seniors are doing project on chromosomal aberration. Good to learn that, because that is one of the way of identifying the mechanism of action of the anti-cancer drugs. Okay, so there are many metallobleomycin complexes that can be activated by reaction with flavin enzymes, NADPH cytochromes, and NADPH cytochrome 450 reductases. So bleomycin binds to DNA through its amino terminal peptides, and is activated complex generates free radical that cleaves the deoxyribose backbone of the DNA chain. Okay, I think in one or two slides I may have to close, and I'll come back next time. Okay, I'll just close this chapter on my antibiotics in the anti-cancer therapy. So bleomycin is highly effective against germ cells, tumors, that is reproductive tumor, germ cells tumors of the testis and ovary. So testicular cancer is curative when it is treated with cisplatin and vinblastine, or cisplatin and etoposide. It is used as a component of the standard ABBB regime of Hodgkin's disease. Bleomycin also is given intrapleurally for malignant pleural effusion. Okay, I think I must stop now. I think will be the last slide. Okay. Okay. Bleomycin causes a little myelosuppression, and it also causes significant cutaneous toxicity, including hyperpigmentation, hyperkeratosis, and erythema, and even ulceration. The most serious adverse reaction of bleomycin is pulmonary toxicity. We've been seeing so much of pulmonary toxicity in this corona time, and they say never it should get to lung. So pulmonary toxicity. Other toxic reactions of bleomycin include hyperthermia, headache, nausea, vomiting, fetal reactions observed in patients with lymphomas that are characterized by profound hyperthermia, hypotension, and sustained cardiorespiratory collapse. Okay, so enzymes. I'll start with enzyme, but I don't think I will be in position to go further. Let's close. This is the last slide I'll use. And next time when we meet, I'll continue on enzymes. Okay. So enzymes are a good class of drugs that are used for malignancies, especially lymphoid malignancies, derive amino acid from plasma, and this L-asp by catalyzing the hydrolysis of circulating asparagine to asp and ammonia. This deprives these malignant cells of asparagine, and which is necessary for protein synthesis, leading to cell death. Resistance also arises through induction of asparagine synthase in tumor cells. So most serious toxicity result from its antigenicity and its inhibition of protein synthesis. So hypersensitive reactions may be fatal due to coma may also be possible, and that is resulting because of the L-asparagine hydrolysis. They may also see pancreatitis. Okay, so let me close my today's class with this. In the next class, I will continue the series of anti-cancer drugs. Is that clear? Hello?
Yes, sir.
Okay, okay. Now, who is this?
Archana, sir.
Archana, you take the attendance and
It's already sent in group, sir.
It's already sent in group? Okay.
Yes, sir.
Okay, okay. Then I will try to come back again on Thursday. Okay, Thursday, wait for my class. I'll continue this on Thursday. Is that clear?
Yes. Okay, sir.
Okay, okay. Have a good day. Bye.
Bye, sir.